According to the American Cancer Society, about 1 in 7 men will be diagnosed with prostate cancer during his lifetime. We talked with Dr. Mark Fleming from Virginia Oncology Associates about some new options for prevention and treatment. Dr. Fleming, prostate cancer is one of those subjects that for many years people didn't really want to talk about, but these days it's a more open conversation.
Yes, I'm glad it's a more open conversation now. Last month was Prostate Cancer Month, and we brought many awareness to with healthcare awareness and early detection programs.
All right, and so when we're talking about early detection, what does that mean?
Early detection is not screening. Early detection implies an informed patient who wants to look at ways to know about the disease and what can be done to prevent the disease.
And it affects men?
Yes, so prostate cancer is a disease strictly of men, typically older men, but prostate cancer can infect all men from age really 35 and above. And early detection programs look at men who are at high risk, typically men with a family history, African American men, and anyone who is interested in being healthcare advocates for their own health and looking at ways what can be done. During a typical early detection program, you'd want to get some awareness. You'd want to have a digital rectal exam as well as a blood test called a PSA, which stands for prostate-specific antigen, which is a blood test that helps detect prostate cancer.
And what type of clinical trials are being conducted these days on the subject of prostate cancer?
Oh, lots of clinical trials. We perform a lot of clinical trials here at Virginia Oncology Associates, but there's clinical trials for early stage disease when men are first diagnosed, looking at the best options, be it surgery, be it radiation therapy. Here locally we have the Proton Center, we have radiation therapy with external beam radiation therapy as well as brachytherapy. So lots of options for patients. And in advanced disease, we actually have 6 new drugs that have been approved in the last few years. And most of those clinical trials were performed here locally in the Hampton Roads.
Wow, so lots of new innovation, lots of new research, and I'm sure that technology and the advances in technology also contribute to being able to treat prostate cancer?
Yes, so it's a disease that often most men are quote, cured from their prostate cancer. Unfortunately, about 1/3 of men, regardless of which modality is chosen, their disease recurs, but we're making lots of advancement in terms of early detection as well as the advanced treatment options.
All right, so what age should a man be when he starts to think about if he's at high risk?
So the frustrating thing about prostate cancer, there aren't any warning signs. So that's why early detection is important. The big confusion is that there are a lot of mixed signals that patients have been receiving and doctors have been receiving. Recently there was a recent task force recommended against early detection, but a person who treats prostate cancer, I advocate early detection programs. I think that men with a family history would be very reasonable to start looking at early detection at age 40, as well as men who are at higher risk, such as African American men. But I think any man who is an advocated patient that can begin that process, but I think 40 is a reasonable time frame depending upon your risk factors.
And early detection, can that make a difference?
Yes, absolutely. We can detect things earlier and the treatment options are better. Some of the naysayers against early detection is they think that there's a lot of morbidity associated with the treatments. While that can be true, we can do much better, and our treatments are much more targeted, and patients do much better, and they live healthy lives as a result of early detection.
Dr. Mark Fleming is with Virginia Oncology Associates, 40 board-certified physicians in 12 locations across Hampton Roads. To find the location nearest you, go to virginiacancer.com.